There are three very common sequelae of acne. The first is post-inflammatory erythema. Those troublesome red macules and patches that still persist when the acne papules have cleared. Next is post-inflammatory hyperpigmentation. We classically see that in our skin of color patients. And the third sequelae that we see very often is scarring. And the scarring could be atrophic scars, which are the most common type, and they can be divided into boxcar, ice pick, and rolling scars. I think the majority of our patients are concerned about the sequelae of acne. When they receive treatment, they want everything gone. Right. Not only papules, pustules, etc., but they want the redness or the hyperpigmentation gone. So it's not everyone, but I would venture it's the majority of our patients. I know personally with my skin of color patients, the chief complaint is often the dark marks, the discolorations, and not the acne itself. They'll also come back and they'll have no acne lesions, but they'll tell me my acne's no better. And what they're referring to is the hyperpigmentation. For PIE, it can take many months. We're talking about 3, 6, maybe 9 months. It depends on the individual. Now, there are some who have resolution as their acne is being treated and we're damping down that inflammation, but not everyone. There are medications that we can use to decrease that erythema. They're not FDA approved for this particular indication. We have oxymetazoline, bromoridine, for example. People have used timolol. So there are several different agents that are available. Small studies have demonstrated improvement. We need larger, randomized controlled trials. For PIH, there are medications. Our gold standard of treatment for post-inflammatory hyperpigmentation, not only from acne but other disorders, is hydroquinone and a 4% concentration. Some patients are concerned about potential adverse events. And now we have a whole class of cosmeceuticals. And these cosmeceuticals combine various agents and they attack that pigmentation, whether it is attacking tyrosinase or they're tyrosinase inhibitors or they're blocking the transfer of the pigmentation from the melanocyte into the keratinocyte. But we are relying more and more on our cosmeceuticals. Devices most definitely are in vogue, particularly various lasers for both PIE as well as PIH. They're different lasers, but many patients are very, very happy with the results. Chemical peels for post-inflammatory hyperpigmentation are very popular with a variety of agents, be it glycolic acid, salicylic acid, low concentrations of trichloroacetic acid. There's a very interesting study that demonstrated with atrophic scarring that they developed from not only our acne papules and pustules, but also from hyperpigmentation and erythema. So it really behooves us to treat the manifestations of acne early, and that will help prevent the formation of some of the scarring. We also know that there are some patients who are more prone to scarring and those who are not prone to scarring. And that has to do with a whole host of mediators, etc. But for those who are prone to scarring, getting on and treating that acne right away is critically important.